It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events. And get to know the team at your community hospital. And now, Morton in the Morning.
Good morning, everyone, and welcome to today's episode of Morton in the Morning. I'm your host, Julie, and we are coming to you from Morton Hospital, your community hospital right here in Taunton, Massachusetts. We have a great show lined up for you today. We are going to be speaking with members of our audiology team, who actually recently won a couple of really meaningful awards that we are so proud of. They were named the Best Audiologist and Best Hearing Aid Center in the 2021 Best of the Best Community Choice Awards for the Metro South region. So we are so excited to talk to this award-winning team. Before we do, I wanted to share some exciting news from Morton Hospital, and that is that we are hosting another hiring event. Actually next week. So we've actually already had one virtual hiring event this year back in January last month. And we have another hiring event coming up, and that is actually a regional event, and that is to support the hiring of nurses and nursing assistants at all of the hospitals, the steward hospitals in Massachusetts, including our own Morton Hospital. So that event is Wednesday, February 23rd and Thursday, February 24th from 8 a.m. to 4 p.m. It is a virtual event, but that means you register and you can speak with somebody, and if you're qualified, you'll get set up with an on-the-spot interview with the appropriate department. And we, for this particular event, are looking for nurses, as I mentioned, in areas such as the ICU, the emergency department, psychiatry unit, and our OR and PACU, as well as general medical surgical nurses. And we're also looking for nursing assistants. So that is for this particular event. If you are interested in signing up, or if you know someone who is looking for a new career at a new hospital like Morton or any of our other steward community hospitals, best way to find the link to sign up is to check out our Facebook page, which is facebook.com/Morton Hospital MA. And we have been sharing the post about that event with a registration link right online. So we hope you'll take a look. We have welcomed so many new team members to our hospital, even over the past couple months at our new hire orientations, and many different disciplines, nurses, nursing assistants, but also many of our ancillary areas like imaging and patient access and lab. So we also have plenty of open positions available in both those clinical and non-clinical areas. If you check out our website, jobs.steward.org, you can browse everything that we have available, and you can sign up for a career opportunity here at Morton Hospital. We would love to have you as we continue to grow our team. All right, so that's one announcement. I have a couple others at the end of the show, but I do want to get right into today's show because I'm really excited to chat with our special guests from our award-winning audiology program. So today we are so excited to be here with our audiology team at our Speech, Hearing, and Language Center right here at Northwoods Medical Center up on Bay Street in Taunton, one of our satellite facilities. And we're going to be talking about our audiology services that we offer to our community. So we have three wonderful team members here in the room today. So I want to start by having everyone tell me a bit about yourself. So we'll go around the room. Let's start with you, Marilyn.
So my name is Marilyn Spinelli. I'm the audiologist here at the Northwoods Medical Center, Speech and Hearing. And I've been here since 1986, so over 30 years.
Wonderful.
I've sort of adopted Taunton as my community here. I just love it here. I love Taunton. So I got into the field of audiology because I used to babysit some children in my neighborhood when I was a teenager who were deaf.
Oh, wow.
And they sort of got me into the deaf culture. And I ended up going to school for deaf ed. And as part of that curriculum, I took my intro to audiology at that point in time and fell in love with the field.
Excellent.
And decided to pursue the degree for audiology. And
Great.
I did my internships in Boston and all throughout Connecticut for grad school. But I came here in 1986 and never looked back. I've been here for over 30 years now, servicing my patients.
Excellent. And Mark, I know that you don't have that long,
No.
that much longevity here. So tell us about
Yeah,
how
I've
long
been here
you've
about,
been here.
my name is Mark Marcel. I'm the audiology assistant. I've been here about 4 years, I would say. I think right around there.
Getting there.
Yes, getting there. So, how I got in the field is I had, I was your typical kid with ear infections constantly. I had the PE tubes, so I had all those, doctor's appointments, hearing tests to make sure everything was fine, and it just progressed. I got my bachelor's degree at URI for communication disorders. I'm also about a year away from my doctorate, but that's another story. I love it here. It's I like the diversity of patients that we have, from the newborns all the way to our elderly who are over 100 years old.
Yeah, we see.
Great.
We see the full gamut from birth to 100,
Yep.
really.
Wonderful. We'll
Yeah.
definitely chat more about that.
Yeah.
So Deb, who is the supervisor over audiology, if you'd like to introduce yourself.
So I'm Deb Janik, and I'm actually a physical therapist by trade. I have a combined number of years at Morton Hospital, about 28 years, but audiology is new to me. I've been with overseeing this program about 2 years, and we are a fabulous department, a tiny department, but the rewarding experiences that patients have when they come here to open up the world of sound to them, to babies, to elderly, and to improve communication is just a wonderful experience. So I'm really learning too.
Great. Well, I look forward to learning about the services a bit further. So before we talked about how long each of you has been here, how long has the Speech, Hearing, and Language Center actually been here at Northwoods Medical Center, or wherever it started?
So it began, because I'm the oldest one here, I think, it began over at the Thayer Building.
Oh.
Many years ago.
I didn't know that.
Yeah, so it began over at the Thayer Building. We had a huge office suite, the one that lines that whole outside wall. I think it's orthopedics now. But
Okay.
Ellen Zane was the director way back then, and she really wanted like top-notch speech pathologists and audiologists. And she started the whole program, and that was, I started in 86. I think the program began over there 2 or 3 years prior to that.
Okay.
So like mid-80s.
Great.
And then after about 7 or 8 years, we moved here to Northwoods. We're very fortunate because we could plan our space here, excuse me, which means we had to build this soundproof room that we're in today.
Yeah.
And we could customize everything for our hearing aid center to our audio suite, which we're recording in right now.
Okay. So you've been here almost since the inception of the center.
Correct. Yes, exactly.
All right. Well, great to get to know each of you a bit further. We have a lot of topics to cover, but before we do, we have to take our first break of today's show. So if you are just tuning in, we are speaking with our audiology team here at our Speech, Hearing, and Language Center located at Northwoods Medical Center, and we'll be talking about their services as well as signs and symptoms of hearing loss when we return. So stay tuned. We'll be right back after this short commercial break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
From all of us at Morton Hospital, thank you to our community for voting for us in the 2021 Best of the Best Community Choice Awards. We're honored to have been voted Best Hospital, Best Audiologist, Best Hearing Aid Center, Best Physical Therapy, and Best Weight Loss Center in the Metro South region. Learn more about our services and quality achievements at mortonhospital.org and follow us on Facebook to stay up to date on what's happening at your award-winning community hospital.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning and welcome back to today's episode of Morton in the Morning. I'm your host, Julie, and we have a great show lined up for you today. We are here with our audiology team. We are recording at Northwoods Medical Center at our Speech, Hearing, and Language Center, which is right off on Bay Street. And we just got to know our team members, Marilyn, Mark, and Deb, and we have a lot more questions for you and a lot of topics that I want to cover and learn more about so that our listeners can also learn about your great services as well.
All right, so it is the Speech, Hearing, and Language Center, but let's talk about audiology services specifically. So let's start with adults. You mentioned you treat both adults and pediatric patients. So what services and treatment options do you offer for adults? What do you commonly see in adults?
So for adults, if they've never been here before, we have to start with a diagnosis first and foremost. So they come in for a hearing evaluation, usually because their family has pointed out to them that they're saying what a lot, or they're not paying attention, or the television is loud, or they have ringing in their ears. Those are some of the more common complaints that people come in with.
Okay.
So the very first thing we do is do a diagnostic workup on them and determine the nature and extent of their hearing loss, the site of lesion. If it looks like there's a medical condition, as an audiologist, we have to refer out. In other words, if there's something that looks like it's treatable for hearing loss, we send them out to the appropriate professionals to have whatever needs to be treated. If it appears to be a permanent hearing loss that is not medically treatable, then we bring them into our hearing aid world and consult with them about hearing aid options to help them hear better.
Okay. And when you say specialist, do you mean like an ENT specialist who might be able to do some sort of an intervention to fix the problem?
Correct. So as part of our testing, we have to determine if it's something that has a medical underlying condition, and usually it needs a referral out to an ENT specialist for perhaps tubes, or if they have otosclerosis, they may be a candidate for surgery for corrective, to correct their hearing loss. And so we refer them out. If they do have surgery, they usually come back for an exam post-surgical, and then again we determine, do they still need help with a hearing aid or whatever.
Okay.
So yeah, usually ENT specialists is where we send them.
All right. So in adults, it's primarily issues with hearing loss. What about in pediatric patients?
So that's a completely different scenario with pediatrics. So there's something called the Universal Newborn Hearing Screening that's been in effect since the year 2000, but it really wasn't mandated in all of the birthing hospitals in Massachusetts until 2007. And Department of Public Health came up with this huge program where every child needs to be screened at birth. It's called the Universal Newborn Hearing Screening Program. So every birthing hospital, actually in the United States now, I think, that every state, right, Mark, is on board with that. And our state happens to be really good with follow-up. I think our epidemiologist just gave us the numbers that we're 99% compliant with all of these babies, which means Morton is no longer a birthing hospital, but we used to be many years ago. Yeah. So now we receive referrals from all surrounding birthing hospitals because we're a DPH-approved facility. So when a child fails their newborn hearing test in the hospital, they have to go for the next level of testing, which is called auditory brainstem response testing. Many, many years ago when I was at the the Thayer building, we used to sedate babies. That was the first sort of go around with how are we going to get all these babies tested, because we didn't get to see them so young. But now the program has really has been fine-tuned, and so we see children before the age of 3 months, and usually with a little sleep deprivation and food deprivation, we get them all set up in this room. We have them fall asleep. We attach electrodes to their head and earbuds in their ears, and we have a monitor that looks at their brain's response to sounds, and that's how we rule out any degree of hearing loss.
Okay.
It's a very involved test. I only do it a couple of times a week, like maybe. Right now we have about 3 or 4 babies scheduled this week, so it comes in waves as babies are born and whatnot. But yeah, it's very diagnostic, and from there, if we do diagnose a hearing loss, again, I would then send them for a workup Typically, they're not surgically correctable at that age, so they would be coming back to our hearing aid center for hearing aids.
Okay.
And how young is the youngest child that you fit with hearing aids?
I have fit them as early as 1 month. It depends how long it takes for them to get to me by the time I get the diagnosis. And then I have to send them for an otolaryngology workup because we really should have connexin testing, which is a testing for a gene for hearing loss. We like to have that done in an MRI before we move forward. So by the time they get back to me, they're usually like 6 weeks old. But I think within the past year, I fit a 3-month-old with hearing aids. So the goal of that is to fit them as soon as possible so that the Department of Public Health gives a 3-month, 6-month window, meaning diagnosed by 3 months, fit with hearing aids by 6 months. And the goal of that is to sort of prevent any speech and language delays before they can even happen by correcting their hearing loss as best as we can.
Okay.
With hearing aids.
Now, this may be a silly question, but if, a newborn or a 1-month-old comes in with hearing issues and they're fitted, is a hearing disorder in a child something that could ever resolve on its own or get better as they are developing, or does it need continued intervention throughout their whole childhood?
That's a really good question, Julie. A lot of parents will ask me that. Do you think this is going to change? Do you think it might get better? Usually, it's pretty much there, and it's not going to go. If it's sensory neural, which is what we have to determine, if it's a neural hearing issue or a sensory hearing issue, it's usually permanent.
Okay.
Typically, they're stable, but sometimes as they get older, it might get just a tiny bit worse until it stabilizes. And when I say older, I mean like between 6 months and a year. And then we follow those children very closely for that very purpose. So initially, when you fit a child that age with hearing aids, it's best to see them like every 3 months for the first year, just to make sure everything is stable, that their hearing aids are, doing what they should be. And then we move it to like every 6 months. And by the time they're 3 years old, we do it annually just to keep a close eye on them.
Okay. Now, aside from the actual testing, are there any behaviors that kids might exhibit that may be indicative of a hearing disorder, like pulling at the ears or something like that?
Yeah, there's quite a bit. Some parents say their child has selective hearing. It could be just that they have a hearing loss to say.
Yep.
They have behaviors that come out because they're not able to hear, or because they're hearing loss, they have language delays, so they're not able to verbally express themselves, so they kind of act out. You're right with the pulling on the ears. That's mostly more for like ear infections, which kids tend to get when they're young.
Absolutely.
And it sometimes parents think they're not, the kid's not paying attention, and it could be just they're just not hearing it.
Right.
So there's all sorts of things kids do, and some out of the normal things you'll notice, like the pulling on the ears, or having to repeat yourself to get the kid's attention.
Okay.
I had a parent last week who said, I knew he wasn't hearing well because he was sitting right in front of the television.
Oh, wow.
And his face was so focused on and he kept saying, Mommy, louder, Mommy, louder. So she knew.
Yeah.
So there's,
So there are some that are a little bit more obvious.
Correct.
Okay. Now, what about in adults? I know you said, saying what a lot, they're just not, again, they could be, could be the whole selective hearing thing, but.
Yeah, mostly, when adults come in, it's, they're having difficulty hearing their grandchildren. They're either saying they mumble a lot or they speak too fast. They find that, the partner or, is saying the TV is super loud to where, it's, too loud,
Uncomfortable for them.
Uncomfortable, yeah. Or the person says that everybody's mumbling,
Okay.
So, go ahead.
I was just going to say, hearing loss is painless. And so sometimes these adults aren't even aware, and they're brought in by their loved ones.
Yeah.
So spouses initiate the hearing evaluation because they'll say, you didn't hear that.
Right.
Or you asked me twice what I said, and you still didn't understand what I said. So a lot of times the patient themselves aren't even aware that they might have some hearing loss, that it really is affecting their families. And so the families initiate, hey, let's go have a hearing test. Let's go see what's going on.
So talk a bit more about what that test looks like. What happens when they come in for their test? Is it the same as when you were little and there's the beeping in the ears and you have to point to your ears? I remember that.
Yeah, very good, Julie. So the very first thing I say to my patients is, come on in, have a seat, let's talk about your hearing, and we go over the case history with them, and that nothing hurts. So nothing hurts. You're just going to sit in this chair and do some good listening for me. I inspect their ears visually with an otoscope just to make sure that I have an open ear canal, that there's not excessive wax or anything. And then we put little earbuds in their ears, and I tell them I'm going to explain everything to you through the earbuds. And as you can see, this is a very large sound suite. I'm on that side and looking through the window, but they can hear me and I can hear them with this microphone pickup. And then under the earbuds, I don't start with raise your hand for the beep. I do what we call speech discrimination testing, because it's sort of like an old-fashioned radio. This is how I explain to my patients that there's a tuner and there's a volume. And so the first part of what I do is just to see how clear their tuner is, meaning when I speak at audible levels for them, which is usually increased volume, can they understand the words clearly? And so I read them a list of words, I score it to see how well their brains are still able to understand speech at higher levels. And then once I get that information, I do a more traditional hearing test, similar to what you said, hear the beep. They're actually called warble tones, which is what we use. And it's ear specific, so I do one ear and then the other. We go up and down the whole frequency range, so it's very comprehensive. So if you're looking like at the keys in a piano, it would be from low end all the way up to the high end. And that will give us a picture as to their configuration and extent of hearing loss. And then we do an additional test if they've never been here, because we have to diagnose for the first time the site of lesion. So I'll either do bone conduction testing to see, is this a sensory hearing loss? We also are very fortunate here that we have state-of-the-art equipment. We have something called otoacoustic emissions, which tests the inner ear or the cochlea. So I can use one or the other to determine where is that hearing loss coming. And as I said before, if I see that it's something medically oriented, I kind of stop and don't talk about hearing aids just yet, send you off to an MD, have you come back and let me know what those results were. But if it's sensory or neural, then I can explain to the patient exactly what type of hearing loss they have and what I think a good treatment plan would be.
And you actually will fit them and issue hearing aids here for most
patients? So we dispense hearing aids,
Mm-hmm.
yes. So we have the audiology component and we have our hearing aid center
Mm-hmm.
component. And Mark is really good, the two of us, but he really focuses a lot more on the hearing aids.
Okay.
I have to do all of the prescribing of the hearing aids just because of my degree, but then we move forward with the fitting and the repairs.
Mm-hmm.
And so, yes, it's in my scope of practice, as it is in Mark's, to fit or dispense hearing aids. We're employees of Morton Hospital, so we dispense them just as part of our scope of practice. And we take many, many different insurances. There's all kinds of programs now through people's Medicare and managed care, and so many, many insurance companies are now jumping on board. In the old days, when I first started, insurances didn't cover anything towards hearing aids, so that has been a really nice trend to see because it's servicing a greater population of people who really could benefit from them.
Are there different types of hearing aids these days, and are certain people better suited for one type over the other? How do you determine what the best fit would be?
Sure. Oh, yeah. There's definitely quite a bit of variety. We have the over the ears, we have in the ears, and it really depends on a number of things. The type of hearing loss you have, dexterity of your fingers, because you got to be able to put the hearing aids on, daily. So the most common we go with is probably over the ear, and then the speakers are the microphones are on top, and then you just have a little speaker in your ear, which then projects the sound into your ear canal. So and with that you have different technology levels, going from your basic to your high end, and that's really depending on your lifestyle of what you're doing, if you're still working, if you're retired, and based on that we suggest the type of hearing aid.
Well, thank you. That was a lot of great information. I have more questions for this team, and I want to talk a little bit more about, the referral process and anything else that you would like our community to know about the services that you offer here. But we are approaching the halfway point of today's show, which means it is time for our second break. But we will come back with more with Marilyn, Mark, and Deb from our audiology team here at Northwoods Medical Center when we return. Stay with us. We'll be right back.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Morton Hospital's nationally accredited Center for Weight Control has grown with the addition of Dr. Deepthi De Silva, our new Director of Medical Weight Loss Management. Our center now offers high-quality medical and surgical weight loss options close to home, with medical weight loss appointments now available in Taunton and Middleborough. To learn if you qualify for weight loss surgery or medical weight loss and to schedule a consultation, call our Center for Weight Control at 508-301-2434.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to today's Morton in the Morning show. For the first half of the show, we were speaking with our audiology team at our Speech, Hearing, and Language Center up at Northwoods Medical Center on Bay Street, and we have some more questions and some time with them. So before we get back into our questioning with our team, I want to remind our listeners how you can contact us here at Morton in the Morning. We have an email address set up that you can reach out to, email at any time, and that is mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. And we're always happy to hear from our listeners. If you want to send us a little shout out, any feedback about our shows, any questions you'd like us to answer, or if you have any suggestions for future shows, we'd be happy to take those into consideration. We want to present shows that you want to hear about. So email us at any time, mortoninthemorning@steward.org. And I want to get right back into questioning our special guest today. We've been talking about the variety of services at our Speech, Hearing, and Language Center, specifically the audiology services. And you were speaking about providing services for adults and pediatric patients, a wide variety of testing and hearing aid fitting services.
So, do patients need a referral to see you here, or can they call and self-refer if they're having issues?
You do need a medical order from your doctor.
Okay.
And then from there, once the doctor sends over that medical order, we give you guys a call, and we'll set up the appropriate testing or consultation, depending on, what you need.
Where they are in terms of the process.
Okay.
Some folks come to us from other offices. They've heard about our hearing aid program, so they just sort of word of mouth, and they'll bring us a hearing test from another facility, which we will accept if it was done by another audiologist.
Okay.
And within a timely manner. And we'll use that information for them and then just jump right into a consultation for them. Some people start out, like I said, they don't even have a diagnosis yet, so they all come to us in different ways. But if they are going to be having a diagnostic workup, they absolutely need a medical order from their primary care. I usually have to explain that to folks. It's not an insurance referral. It's a medical order because we're part of Morton Hospital. So your doctor has to sort of request that test. Once that's been done, then we can move forward with the hearing test. And we don't really need anything after that to fit them with hearing aids because both of us are, it's in our scope of practice.
So what is the frequency of follow-up visits? Because, I'm thinking of, if someone needs eyeglasses, you should probably go for your annual eye exam in case you need an upgrade of some kind. Does that the same thing happen with someone who's fitted for hearing aids?
That's a really good question, Julie. Yes. So, just even routinely adults, I saw somebody, I don't know, last week in their 50s and excuse me, he said, I haven't had a hearing test since I was a kid.
Oh.
And I said, wow, really? I think it's a really great idea for adults to have annual hearing tests.
Yeah.
And I said, how long do you think, this has been going on? He said, I'm not sure, a few years. Once I tested his hearing, I could tell by the extent of the hearing levels that it had been probably there for maybe 5 to 10 years.
Wow.
So sometimes, as I said, it's progressive and it's painless, so people aren't even aware of it. So I'm, of course, an audiologist and promote annual hearing evaluations for, adults especially. Over the age of 40, I would say they should have that as part of their physical. Was that the question?
Yeah. No, well, it's interesting because you think, for certain things like getting your license renewed, sometimes you have to have the eye exam, but hearing is such a big part of driving as well. If you have a hearing impairment, then that puts you more at risk, just like if you have a visual impairment.
Absolutely. So. Now, once they're fit with hearing aids, everybody is different. So we do give a year's worth of services when you purchase hearing aids here. So that's sort of included.
Okay.
And we encourage people to come back if they're having any difficulty at all. Please let us know. These are all digitally programmable hearing aids. So we can change the way the sound. Mark and I are very adept at all the manufacturer's software. So we can go into the software, connect hearing aids to our software, and adjust the hearing aids either to a patient request, a change in hearing, certain functions or features that they would like on their hearing. They're pretty much customized each and every time when they come in.
Okay. So if a patient is having their annual checkup with their doctor, can they proactively request a hearing evaluation, or do they have to be having some sort of issue for that medical order to be sent in?
So I would say they could say to their physician, hey, you know what, I think I should have a hearing test because either my spouse thinks I'm not hearing. Some people, blame it on a family member, but others will admittedly say, gee, I think I'm not hearing so well.
Right.
But usually they have to initiate that. I did have a patient who said to me, I said to my doctor, I think I would like to have a hearing test. And his physician said to him, well, if you have a hearing loss, would you wear a hearing aid? And he said, I don't know. I don't know if I would do that yet or not. And so the doctor said, well, I would only refer you if you think that you would wear a hearing aid. Oh. And so I thought that was a very interesting comment. I'd never heard that before. So I said to him, well, I'm really glad you came, whether you need one or not.
Right.
Even just so we can get a baseline
Absolutely.
On you. So if your hearing does progress, we have this baseline that we can always compare it to and get a much better picture as to how quickly your hearing is declining.
Yeah, especially nowadays where the focus is more on prevention instead of, reactive treatments.
Exactly.
It's such a good idea.
So you don't necessarily have to get a hearing aid. I mean, you can just come and just get a baseline hearing test done, and we'll counsel you about it. We don't pressure people. We just tell them what their results are, suggest what we think would be a good plan for them. Mark, do you want to add to that?
Yeah, I mean, we're here to help you, and whenever you're ready to make that leap, we'll definitely guide you in the right direction.
Exactly.
How do you, so this is, I ask because I also have some personal experience, family members who are just hesitant to put the hearing aid on. How do you encourage people just to turn it on? It's going to help you. I don't know why people are hesitant to use them when they have them.
I think some people think that hearing aids correct the hearing loss, which isn't the case.
Yeah.
They're going to help aid and increase the environmental sounds and speech sounds so you can do better, and when they don't get that initial, I wouldn't say benefit, but positive outcome, but they get frustrated and then they throw it in the drawer. Probably the best thing I always tell my patients is that you need to wear it from the time you're done getting ready to the time you go to bed, even if you're just reading the book. That way your brain, because it's a new way of listening, right? So your brain needs to adapt. Just like every time you get a stronger pair of glasses, your brain needs some time. And if you only put them on for special occasions, you're not going to have that positive outcome with the hearing aids that you would if you wore them more often.
Okay. That makes a lot of sense, actually.
I mean, it's new, and especially for those new users, sometimes you have to get into the psychology behind it as well. Some people are here not because necessarily they wanted to wear hearing aids, but their spouse or family member said, they kind of push them in this direction. Right. So we kind of have to do a lot of counseling as well as to what is the reason. Why are, and some people will really open up to us and say, well, I associate hearing aids with aging or with someone with a disability but everybody's wearing stuff on their ears now, which has helped our industry tremendously. I mean, you can't go down the street without seeing earbuds or earphones or people on, accessory devices. So I tell them, it's really very fashionable now to wear, have earbuds or things in your ears. So whatever it is, we try to get over that obstacle, help them sort of, work their way through it so that they become good hearing aid
And what's
wearers.
also nice is that all hearing aids now are compatible with phones.
Okay.
So, especially the younger generation, people who have hearing loss, they can't wear the AirPods or stuff like that. These hearing aids will stream whatever you're listening to.
So you can pair
listen
it
to,
with your mobile device.
Exactly. So then you can listen to your music, you can watch TV on the phone, pretty much do anything, and it streams directly, even phone calls. So then now that phone becomes a hands-free device pretty much.
Very cool. Wow. Technology has certainly advanced a lot.
It's how we keep some of our teenagers wearing their hearing
Yeah.
aids. I switched them over in their teen years to these, and I go, look, it's going to stream. You can use, and their eyes light up, and because typically children, sort of, decline wearing hearing aids around that adolescent age. They start giving a little pushback. But with the new technology, I mean, they're in here going, hey, can you make this louder? Can you do that? They just love the new technology.
Awesome. That's great.
Now, do you think that people who have gone for a period of time and progressively losing hearing stop hearing those sounds around, like the refrigerator, the horns beeping, the things that you kind of tune out because you're paying attention to the TV or whoever's speaking with you? So now they put on a hearing aid and they can hear all that. So if they put it on and adjust, like you were talking, Mark, they start to kind of tune out those other outside sounds more, and then can focus on what the hearing aid really is there for, but to hear the conversation or the TV or the phone.
Right. So I think your question is multi-part. So most people, this is one of from the time they realize they might have a hearing loss is about 7 years before they actually do something, right? So between that, it can gradually change, and then you start missing all those sounds, and then when you get the hearing aid, it's like turning the lights back on so they can hear everything. Like I said before, the biggest part is to wear as much as possible. That way you get the benefit, and you adjust to the new way of hearing with the hearing aids. It gives you're able to receive all those output sounds that you've been missing, like like you said, the refrigerator running, or even the birds chirping. So it's giving the world sound back to the person.
It must be really rewarding when people are hearing clearly for the first. I mean, I know you see online, those beautiful videos where like there's a baby that hears his mother for the first time. It must be.
It's very touching.
Yeah,
it is. It's very touching. Many tears. Yep. Sometimes there's tears. Yep. But they're happy tears.
Yeah.
Which is a good thing.
Yes.
We love working with our pediatric population.
Yes.
It's really awesome. And Deb, to get to your point, yes, there is habituation, which is what that's actually called in our field. So people are acutely aware, of that refrigerator motor. I mean, I've had people say, it sounds like a Mack truck is driving through my living room. Or when they flush the commode, it sounds like Niagara Falls. Those are typical what we call new user complaints. But like Mark said, if you can get them on track with, I know, just, sometimes introduce them in a quiet environment, like maybe just wear them at home at first, But the more you wear them, the more that habituation is going to kick in. And eventually, they're not so acutely aware. They still hear them, just like you or I, but they're not jarred by those sounds anymore.
interesting.
Yeah.
Well, I have to say, I'm learning a lot here. I'm sure our listeners are as well. And your tips have been super helpful. And I think some of these I'll be able to actually take back and share with some of my family members who may have some hearing difficulties and who should be wearing their hearing aids, and maybe encourage them to do so with some of the great tips that you've offered. So again, a lot of great information. It is unfortunately, though, time for our last break of today's show, but we are not done with our audiology team. After the break, we'll be right back with them with a couple of final questions. So stay with us if you would like to hear more. We hope you will stick around after this short commercial break. We will be right back.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
From all of us at Morton Hospital, thank you to our community for voting for us in the 2021 Best of the Best Community Choice Awards. We're honored to have been voted Best Hospital, Best Audiologist, Best Hearing Aid Center, Best Physical Therapy, and Best Weight Loss Center in the Metro South region. Learn more about our services and quality achievements at mortonhospital.org and follow us on Facebook to stay up to date on what's happening at your award-winning community hospital.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning and welcome back to the final segment of today's Morton in the Morning show. Today our show has been recorded from Northwoods Medical Center up on Bay Street in Taunton at our Speech, Hearing, and Language Center, and we have been chatting with our audiology team, and they have shared so much great information about their services, signs and symptoms of hearing loss, what their testing capabilities are, and some great tips for people who may be experiencing hearing difficulties or who may be considering hearing aids, and when they should reach out for some help and when they should use those hearing aids. So it's been a great show so far.
Lastly, is there anything else you want to share that our community should know or potential patients should know about what you have to offer here?
We're here to help you, guide you with the new technology for hearing aids. Don't be afraid to come on over. Marilyn and I are both knowledgeable. We enjoy what we do, and we'll do everything we can to help you out and give you the best experience and make sure customer service is up top notch.
Great.
I would just like to add that I'm very fortunate to have all of the latest technology and equipment.
Yeah.
I love having the latest technology to offer to my patients, and Morton has been so supportive to me and our department for keeping, it's, as you can see, all this equipment in front of you, and the upkeep of it can be quite challenging. So I am just so thankful, and I think people are surprised when they come and see all of the equipment and technology that we have, but really I'm so really proud of the fact that we are on the cutting edge and we keep up with it because it changes so rapidly. And so we're very fortunate to have this beautiful center and the latest technology.
Absolutely. And conveniently located as well. And
exactly.
This building has had a lot of new life as of late too, with new offices and primary care office that moved over here. So definitely very convenient. Is a lot of access to other care as needed here as well. Okay, well, Marilyn, Mark, and Deb, thank you so much for joining us today. I learned a lot. I'm sure our listeners learned a lot as well. So we appreciate your time. And if they want to call the center just to learn more, phone number is
508-823-3050. We usually are able to get to the phone. Sometimes it's a busy day, so if someone doesn't answer immediately, you can always leave a message and we will get right back to you.
Okay. Great. Well, thank you again so much, and hopefully we can have you all on again soon.
Okay. Thank you,
All
Julie.
right.
Thanks, Julie.
Thank you.
All right, well, that wraps up today's show, at least the interview portion, before we give you some final updates before the end of the show. Thank you again to Marilyn, Mark, and Deb. It was great to visit the audiology space at our Speech, Hearing, and Language Center, and I certainly learned so much. I hope you did as well, and I hope that our community will spread the word to anyone who may benefit from the audiology services that they offer right up at their Bay Street location. Again, the phone number for the Speech, Hearing, and Language Center is 508-823-3050. Again, 508-823-3050. Give them a call. They have a great secretary, Nina, who would be happy to answer your call and give you some more information and help you with the referral process as needed. So thanks again to our audiology team. Great show today, and I hope everyone learned just as much as I did, along with some great tips that they can bring back to friends and family members. So before we end today's show, just a recap or summary of what's happening here at Morton Hospital in terms of upcoming events and celebrations, and maybe some new doctors to let you know about as well. So, as I mentioned at the beginning of the show, we do have a virtual hiring event next week. It is a Steward North Region virtual hiring event, meaning it is to support the hiring of nurses and nursing assistants at the Steward, Massachusetts hospitals, which of course we are one of. So that event is Wednesday, February 23rd and Thursday, February 24th from 8 a.m. to 4 p.m. It is virtual, which means you sign up online. Someone will contact you, find out if you're a qualified candidate, and if so, they will set you up for an on-the-spot interview at whichever hospital you are interested in and the department that makes most sense for you based on your background and your area of expertise. So to find the sign-up link, just go to our Facebook page, which is facebook.com/Morton Hospital MA, and you can sign up there. Again, this particular event is for nurses and nursing assistants, but we do have several other clinical and non-clinical positions open here at Morton Hospital, and you can look at those anytime by visiting our website and going to jobs.steward.org. So we hope we can continue to grow our team. We have welcomed many new members to our team over the past year and even within the past 2 months. And we're continuing to grow and looking for new talent to join us. It's a great place to work, so please check that out, jobs.steward.org, or find the information about our virtual hiring event next week on the 23rd and the 24th. This week, very timely with Valentine's Day, we are actually celebrating Cardiovascular Professionals Week. So we have a great cardiovascular team here at Morton Hospital who perform a variety of tests, both within our vascular lab and our cardio unit, such as EKGs and echocardiograms. They really put their heart into their work and care very much about our patients, some of our most vulnerable patients, and they work very closely, of course, with our Steward Medical Group New England Cardiology team. So we want to give a shout out to our cardiovascular services specialists. Thank you so much for all you do for our hospital, for our patients, and for our community. As far as new doctors here at Morton Hospital, we have once again grown our Center for Weight Control team. And if you recall, they also recently won, like our audiology team, they won a Best of the Best award. For 2021, they won the Best Weight Loss Center Award for the Metro South region. So thank you so much to our community for voting for our team for that award as well. And we've grown that team, which is right across the street from Morton Hospital, located at 91 Washington Street in the Liberty Medical Building, by adding bariatric surgeon Dr. Decio. He has now joined our team, and we have 3 bariatric surgeons. And we have also welcomed Dr. De Silva, who is the new director of our medical weight loss program. So now we have both medical and surgical options available right here in Taunton, as well as Dr. De Silva will be seeing patients in Middleborough at our specialty clinic over there in the Compass Medical Building. So to learn more about our Center for Weight Control, to find out if you are qualified for weight loss surgery or medical weight loss, or to inquire about our monthly virtual info sessions and support groups, you can call our Center for Weight Control at 508-301-2434. That's 508-301-2434. And we've also grown our orthopedics team and actually added a couple of specialists who are now looking to do spine surgery here at Morton Hospital. So our chief of orthopedics, Dr. Drew Rogers, he is located down at University Orthopedics in Rainham on Paramount Drive, and he has welcomed these individuals to his team, and they will be performing surgeries here at Morton Hospital. So we have Dr. Basks and Dr. Chow, who are both specialized in spine surgery. And then we also have Dr. Newland, who is specializing in orthopedic surgery. So we're very happy to have grown our orthopedics team and to welcome these new team members to the surgical team here at Morton Hospital. There's certainly a need out there for orthopedic services. So we really now have a full complement of orthopedic specialists, from general orthopedic surgery to spine surgery to hand surgery and podiatric surgery. So welcome to all of our new team members. So exciting that we're continuing to grow our medical staff here at Morton Hospital with new specialists to bring that care right here to Taunton so you don't have to travel. If you ever want to find a provider, you can check out our website and click on the Doctor Finder link at mortonhospital.org, and then you can search our providers there by specialty or by location. Or you can also call the Doctor Finder line at 800-488-5959. And I mentioned Dr. Rogers, our chief of orthopedics. I would actually like to give him a shout out as well because, our orthopedics team is always using the most innovative new technology. And Dr. Rogers actually just recently here at Morton Hospital in the last 2 weeks completed the first ever balloon spacer procedure within our system. He did that at Morton Hospital. It's an innovative new procedure using an in-space device, which was FDA approved in 2021. And that was performed on a patient with a rotator cuff that was unfixable. So congratulations to Dr. Rogers. Kudos to you for performing this new and innovative procedure. We're so happy to have you here at Morton Hospital and that you have brought these innovative and new services and options for people with orthopedic injuries right here to Greater Taunton. So shout out to Dr. Rogers for that. And also a shout out to our medical director for our MORCAP, Substance Use Disorder Treatment Unit, Dr. Patricia DeLima. And we celebrated her this past week because she officially achieved her board certification in addiction medicine. So that is the specialty that she is practicing up on our MORCAP unit. We are so grateful to have her and very proud of her for earning that achievement. So again, to recap today's show, we have some exciting events coming up. Our virtual hiring event. We have welcomed some new specialists, and shout out to our audiology team for joining us today. Again, I learned a lot of information. I hope the listeners did as well. And congratulations to them for earning those Best of the Best awards for 2021. So that pretty much wraps up today's show. Just a reminder about how you can contact us here at Morton in the Morning. You can send us an email anytime at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. We would love to hear from our listeners to find out how you're enjoying the show. And if you have any ideas for us for future shows, just reach out to us anytime at that email address. That's it for today. We hope you will continue to join us every Wednesday at 11:05 a.m. right here on WVBF, 1530 a.m. or 99.7 FM. And let us know what topics you'd like to hear about in the future. Thanks again, and from all of us at Morton Hospital, we hope you have a happy and healthy week. Morton Hospital's nationally accredited Center for Weight Control has grown with the addition of Dr. Deepthi De Silva, our new Director of Medical Weight Loss Management. Our center now offers high-quality medical and surgical weight loss options close to home, with medical weight loss appointments now available in Taunton and Middleborough. To learn if you qualify for weight loss surgery or medical weight loss and to schedule a consultation, call our Center for Weight Control at 508-301-2434.